Hi, everyone. This is Dr. Fab Mancini, and I'm so excited that you decided to come and watch this video because today I have the privilege, the honor of interviewing one of the greats in chiropractic, especially when it comes to extremity adjusting, and that is Dr. Mitch Mally. Hey, Mitch, how are you today?
Good. I'm doing great, Fab. How are you, my friend?
I am doing amazing. And, I've been looking forward to interviewing you primarily because, Mitch, I'm a big fan of yours. And I've been telling people that, I'm just so grateful that you have stepped into the profession in this component of teaching us how to properly expand our practices by implementing or integrating extremity adjusting. In the schools, unfortunately, we don't do as good of a job as preparing chiropractors for the future when it comes to extremities, but you took up that baton and you have created the Extremity Experts Academy, which is one of the greatest resources right now for chiropractors to be able to learn. But I wanted to ask you a little bit about where are you seeing the world of extremities in chiropractic, and where does this passion come from for you to continue to teach us that, this is one of the best ways to position chiropractic in order to grow?
Well, Fab, that's an absolutely incredible introduction, and thank you for that. The extremities, obviously, is a 7-to-1 ratio versus the spine. You got one spine, but you have 7 extremities: foot, knee, hip, shoulder, elbow, wrist, and TMJ. So this affords doctors and students to learn a tremendous opportunity. It's kind of like an investment where you get a 7-to-1 ratio on your return. One spine, 7 extremities. So you have that many more conditions and opportunities, especially in the sports and occupational medicine realm. You have an opportunity to treat areas that, like you said, the schools do not profess to create a specialty or specialization in these extremities. There's 25 entrapment neuropathies in the upper extremities and 17 in the lower extremities. And most chiropractors cannot answer a single one of those questions. And when I work in the orthopedic surgical world, as I do in my practice, is actually located in the Mississippi Valley Surgical Center Plaza. And I work with orthopedists all the time. And it's that newfound respect that the orthopedists are going, we didn't know you knew anything about shoulder, elbow, wrist conditions, foot, ankle, knee, and hip, and so on and so forth. And I told them this is a very specialized, very small niche, but it's growing. And the more we reach out with your help and the help of the students and doctors worldwide, we're able to afford people such a great opportunity to become the leading extremity expert in their community and build a tremendous dream practice.
It's so interesting because when I attend one of your lectures or I take one of your online programs, I get so empowered as a chiropractor to recognize that we can do so much more than we've been trained to do. But let's talk a little bit about laser therapy. You have been integrating laser therapy with your protocols, with your teachings, and especially your relationship with Multi-Radiance Medical, which is the lasers that I've been using for years, and I know you do too. So tell me where did this interest about laser, how did you find out about laser therapy, and what made you want to integrate it into your protocols?
Well, this is a very good question. Also, Fab, I don't know if you know, I was actually the first or second in the United States to have cold laser. I was part of the 7-year double-blind study that brought laser to the US. And I was also involved with Baylor University and General Motors. In fact, I spoke to General Motors as a leading expert in our profession. And laser has been used in my practice since 1991. My affiliation with Multi-Radiance was spawned by the evidence of the science and the research, which is astounding by Multi-Radiance. So I converted all my lasers over, and I think we've got 6 or 8 lasers now. And we not only use it on the human side, But we also have a very strong presence in the veterinarian. As you know, my wife is an equestrian, and we have two big labs. And just yesterday, there was an injury to one of the horses where we have ours stalled in the barn. And you would not believe the results we heard overnight by the owners of this horse that was injured during transportation. And the results were just incredible. So laser is very safe. There are all kinds of lasers. And I have elected to affiliate myself with Multi-Radiance because I want the best for the best, and they deserve the best. And as you know, we have stars and celebrities, world-class and professional athletes flying into Iowa for care, but they also have a very diverse and broad network of laser using physicians, chiropractors, trainers, etc., throughout the world, I believe in over 60 countries.
You know, I love the fact that you said science, because actually that's what also led me to them too. And then, of course, I was going through an issue with one of my sons in which I was looking for the best possible solution, and it was their laser that actually got a result. But let's talk a little bit about the implementation of laser in a practice. You have one of the biggest practices in the country. You treat some of the biggest athletes in the world, like you mentioned. So maybe share with me one or two stories about where is it that you see the benefit of laser, especially combining it with chiropractic care, especially when we adjust the extremities.
Well, that's really interesting because this goes back to the science of Oshiro's principle, which happens to be when you first apply laser to an extremity, you have to apply it first to the most proximal, then proceed distally. And a lot of people don't know that. If it's a hand problem, you start at the area of the upper extremity by the shoulder and work your way distally. And this affords a much better pooling, if you would, of the photobiomodulation and the healing principles. And the same with the equestrian. We start with the spine and then we go out to the extremity as opposed to the extremity and then to the spine, right? You start proximal and then work distal. That is called the efferent, where you go from the spine distally, right? But don't forget, we also have with the Valix phenomena, a distal to proximal, which would be how the extremity thereby affects the spine. So you're making a full circle of providing healthcare to patients, whether four-legged or two, and you're providing the same neurological changes through photobiomodulation. So you're allowing the body to undergo a targeted, specific dose for their specific injury that allows the neurovascular supply to promote healing faster than any other application whatsoever. And with my type of practice, we need fast and furious results. Noting a proper diagnosis and the proper therapeutic effect of the cold laser, we even have several patients using the rental program that we have, where they can rent it for a month or two and use the actual laser at home, given the guidance and the safety disciplines and directions we provide. They sign off and they can actually provide a recurring revenue for doctors by having the patients utilize the at-home lease or rental program. What an opportunity.
You know, it's interesting that you mentioned that, because when I heard about the rental program, I jumped all over it. And I started calling my friends that were saying that patients were not coming in or that they had to be forced to close their office. I'm like, look, you can still help people. Go ahead and rent the programs and get them the lasers. And I know that that will help them tremendously. I've always seen a great collaboration and a great match when it comes to chiropractic and laser, because it's an extension. You know, the laser is going to do some of the functioning on the soft tissue that the chiropractic is able to free that joint and be able to allow it to heal much faster. Is there a case that you can remember that perhaps surprised you how quickly somebody healed, especially when you introduce the laser component?
Well, you know, with the battlefield of practitioners and the field of agony, both physically and financially for the patient, You have to consider the quarantine problems with COVID-19 and today's issues affords a patient some concern or fear in some instances to come into your office. Once you have the patient learn how to use this and follow the protocol and procedures, we're having results that are just second to none. For example, a very well-known NBA basketball player and with a neuroma-like condition, metatarsalgia, problem in the foot, with all the pivoting and jumping and so on and so forth. When I corrected the alignment, there's still the soft tissue element. And the perineural fibrosis, the scarring around that nerve, has been eradicated by the effective use of the multi-radiance lasers that we've done. So we took the metatarsals and the tarsals, restored alignment, and then had the laser used at home 3 times a day for about 4 or 5 days. And then because of a washout, you don't do it on the weekends. And then you start again 2-3 times a day. And we're having absolutely incredible results. Whether it's a star or a regular patient, everyday person, just like you and I, hey, look, we deserve the same effect of any other professional or celebrity or world-class athlete.
Mitch, when you use it for you and PJ, what are some of the components that you like the most about that? In what areas?
For us, it's like neck pain or a burn for my wife, or a bruise or an abrasion or swelling or sore joints. You know, arthritic joints start to show up as we get a little bit older. They get stiffer, sore. And, you know, the use of the laser is really great because photomyomodulation has a secondary effect called angiogenesis. And my surgeon, my vascular surgeon right next door to me, loves the laser because after he does vascular surgery, the angiogenesis, right, is creating more blood and more circulation to promote faster healing. That provision, when I explain it to orthopedists and to physical therapists, as well as to other surgeons, is something that some are not aware of it, but they're very intrigued by the physiology.
I love it. So one last question. So let's say somebody just watched this video. Somebody all of a sudden may have a laser, but has not really used it appropriately. Or maybe somebody's thinking about incorporating laser therapy, especially multi-radiance, into their practice. What would you say to somebody that's thinking about laser right now? And why is it that the laser therapy will be a great decision for your practice and your patients?
Well, it's always about, you know, people think about income. I think about outcome because outcome generates income. If you want to enhance your income, then become more diverse in your clinical outcomes. What other types of valuable equipment and technology can be used that will yield the fastest clinical outcome for the patient in the fewest number of treatments? And that, my friends, is the multi-radiance lasers. I would go to Mr. Mally, M-A-L-L-Y, at live.com. All right, and they could email me directly. They could also go and check out my site at drmally.com, drmally.com, and they could take a look at the Extremity Experts Academy, which I've developed because of this crisis and the changes in today's society. Everybody deserves to learn as much as they can.
Well, you know what? You've done that with me. You've done that with thousands of chiropractors. And I just can't thank you enough for your passion, your continuing discipline to try to help us all, to help this profession move forward. And for those of you that are listening, I just want to thank you for making the time. Please seek out Dr. Mitch Mally. I know that he could be a great mentor to you, somebody that will guide you properly in how to incorporate and how to learn how to better serve your patients through extremity adjusting. And also make sure that you think about multi-radiance lasers. I can tell you that these laser therapies have been a great addition to the chiropractic profession, not only in my life, in my practice, but also in many others. And I want to just say thank you for being able to continue to be a part of this profession. You know, the world needs us today more than ever. And like Dr. Mally said, keep thinking about your outcomes. The more that you can integrate the right technologies, the right efforts to better serve your patients, the money will always follow. So focus on your patient service, and I know that you will become one of the most successful chiropractors in the world. Well, thanks, Dr. Mally. God bless you, and I look forward to seeing you real soon.
Thank you, Fab, for your commitment and your passion to this profession. And I will give you a new word, Fabsolutely the best.
God bless.